Welcome to the Bare Naked Shrinks, with your hosts Dr. Danny and Dr. Courtney, here to strip down disordered eating and negative body image.
Hello, and welcome to this episode of the Bare Naked Shrinks. Today, we are so excited to have Dr. Caroline Christian with us. She is a postdoctoral scholar at the University of Pittsburgh and a licensed psychologist in the state of Pennsylvania. And she'll be talking with us today about critical risk periods for the development of eating disorders.
Thanks so much for having me on.
Yeah, we're so excited to have you. Okay, so let's get started with our
cake and crap.
I'll go first. So my cake this week is one of my best friends was in Australia for 3 months for work, which was so cool for her and such an experience. And obviously I've missed her a lot. And she just got back last weekend. And so I've already hung out with her like 3 times and it's just super excited to have her back. So that's been really fun. And my crap would be that I have an interesting relationship with my mom, and she sent me some not wonderful text messages this week, the last of which was, well, Courtney, I wish you well. So just going to leave it there.
That's like how I used to talk to guys I was dating when I was like 21.
Mom told me that. So
good times. I want to hear the full thread at some point.
What about you, Danielle?
I was having a hard time like thinking because it's like things have been really routine, like nothing that interesting has happened. And this is so boring, but I've been going through, Courtney and I are both kind of like clothes hogs and like hoarders and we love shopping and we love keeping clothes. The cake is that I've been going through old clothes, like really organizing, and Matt has to set me up for it because I have really bad ADHD, so like planning and like whatever, so he's like, start here, but the cake of it is that I've been finding new clothes. Like this is like this caftan I've literally never worn. It's like a vintage caftan that I got years and years ago. And I was like, oh, I remember you. So that's been fun. I've been shopping my closet and saving money.
Exciting. I love that.
So yeah,
I should do that.
The crap is that I'm having to organize, but the cake is that good things are coming out of it.
Yeah, we love a crap that's also a cake. And that's what mine is too. My crap is that Pittsburgh's been having just the most insane weather. We had this week this windstorm that took like 20 minutes, like was the shortest little windstorm ever, but it tore our city to shreds. We have like hundreds and hundreds of trees down. We still have like, I think it's 70,000 people are still without power. So it's just been like a really interesting time for our city. And actually when the storm hit, my side hustle is that I coach high school tennis. And so I was at a high school tennis match when it hit. And then I had this van of high school boys that I had to figure out how to get home when all the roads were closed and all the power was out and the lights were out. It was a really stressful day. So that was probably my crap for the week. It's been an interesting week, but I think the cake that has come out of it is that some of my friends without power are coming over more because they want to use my power. So I've gotten to have more community and shared resources. And there's been a little bit of a coming together that's been really sweet about it all.
Nice. Okay, so for our little fun game today, we are going to play This or That Therapist Edition.
Okay.
So I'm going to give you 2 options and we all get to go around and identify which one we would choose. Okay? Okay. So the first one, worst red flag. I've never been to therapy, or my therapist says I'm a work in progress.
Never been to therapy.
I would definitely say I've never been to therapy. I'd be like, well, we all need therapy.
Yes, indeed.
The work in progress one could be like, I feel like more ambiguous. Like you don't know exactly what that means. At least
That
they're in
means
therapy.
they're working.
Exactly. Okay. Preferred coping style, dissociation or dark humor?
Humor for sure.
Yeah, it has to be dark humor.
Definitely dark humor. Definitely dark humor. Okay. Would you rather go to a psychoanalytic conference or a silent meditation retreat?
Psychoanalytic, 100%. Could you ever see me being quiet for like more than 5 minutes?
Yeah.
No.
Mindfulness is not something that comes naturally to me. And so I definitely would struggle with a whole weekend of silence.
I think I feel like I should say the silent meditation retreat as a DBT therapist. And I do like mindfulness. At the same time, I would be so curious what a psychoanalytic conference would look like. And I think that would just be really exciting and entertaining to attend. Okay. Emotional dysregulation or the fun type of chaotic?
I'm going to say fun type of chaotic because that is you and me, Courtney.
Yeah, I think it's got to be fun, chaotic.
Yeah, 100%. Definitely the fun type of chaotic. Okay. My psychic told me, or I read about this on TikTok.
I read about this on TikTok. I can't take psychic stuff seriously.
Yeah, I unfortunately start every conversation with something I saw on TikTok, so that's gonna be me. But I love the idea of a psychic and getting your wisdom from there.
I know. I feel like I love the idea of a psychic too. And I would like totally do that myself. I guess I would probably choose my psychic told me because I'd be like, oh, tell me more. Give me your psychic's information.
Yeah.
I want to talk to them.
My like other best friend, Kim in New York, she actually went to this like pet psychic to
Oh my gosh, my friend's about to do that.
to talk to her deceased dog. And honestly, I would do that. I would like talk to Humphrey, but like the whole person thing is kind of creepy in a way.
I don't want to talk to a pet psychic to like help me understand like what my dogs are thinking like now.
Okay,
Yeah.
right. Yeah,
Yeah.
people do that. That's more typical than wanting to talk to your deceased pet.
Would love, all I want is for my dogs to understand me just a little bit, just for me to like, just to understand I'm coming back. Like, it's gonna be okay. Like, they just give me the most pitiful faces.
Okay, so this is relevant then. More emotionally regulated, you or your pet?
Sorry, that's me. My pets are absolute messes. They're beautiful, but they are drama queens in very different ways.
I think we're tied.
Yeah, I have two. I would say like Frank is probably more like I'm more regulated than Frank for sure. I don't think I'm more regulated than my other dog, Oscar.
I forget we both have Franks. My Frank he's like a guard dog, so he will bark and lose his mind, but he can like calm down real quick. So that's why I say we're tied, because like I can get mad really fast, but then I can like calm myself down really fast. And then Iggy is a little Lhasa Apso, and they are very mouthy and moody, but like pretty chill most of the time. So we're the same.
Okay, more disorganized. Your sock drawer or your attachment style?
That's hilarious. That's actually hard because, you know, my socks, I'm like really into funny socks. So I have a lot of them and they're folded, but they're not organized. But I'm also pretty anxiously attached solidly. So I don't know. Again, tied, I guess.
I would probably say I'm tied too. I think my sock drawer is pretty disorganized and so is my attachment styles.
I think I would need like a reference group of what other people's sock drawers look like because it works for me. Like I have socks on my feet, but I don't really know where the bar is. Like, what does an organized sock drawer look like?
I was at I had like a slumber party with my friend Emily a few weeks ago. And granted, she is single and doesn't have children and has a beautiful, luxurious condo with lots of space. She was putting away her clothes and it was unbelievable. She had a row of jean shorts, like nothing but cut off jean shorts. And they were all rolled perfectly where you could see the label and which brand they were. I was like, well, people do that. That's perfect Emily though.
Okay, well, that was fun.
Yeah, that was fun.
Okay, well, let's get into the educational portion of the day. And Caroline, we'd love to hear from you about the critical risk periods for the development of eating disorders.
This is like one of my favorite things to talk about. So I appreciate you letting me yap for a little bit.
Yeah, of course.
So my research is really rooted in how do we navigate these periods of time that are really marked by big physical changes, changes to our body, changes to weight, changes to how we eat, especially as we're in this society that really values smallness and thinness. And so there's a lot of critical risk periods that I'm interested in. One of them is like menopause or recovering from an eating disorder, recovering from a traumatic event. The two that I'm going to talk about for the most part today are going to be adolescence, which ends up being a huge one for eating disorders. And then also the pregnancy and postpartum transition period. And so a lot of what I do with my research is try to investigate how eating disorder symptoms change across these periods and also to understand why, when we're going through these big physical changes, do some people end up developing eating disorders and other people come out relatively unscathed? So, what are some of these factors that impact how well we fare with some of these tough times? And so with adolescents, I think it's really interesting in the context of eating disorders because the majority of eating disorders onset during this adolescent time period. And there's a lot going on, right? It's a time where puberty happens, people gain weight, they grow taller. There's a lot of societal messaging around that and what that should look like. And so it's actually very common to develop an eating disorder during adolescence. We see that about 10 to 15% of adolescents will develop an eating disorder by the time that they're in their 20s. Those numbers are even higher if we're just thinking about some disordered eating behaviors or dieting behaviors that might be unhelpful. So for me, I'm really interested in with this high prevalence at this time period, what are some of the risk factors or the protective factors that might impact how eating disorders come about during this time? And so, one that I notice a lot, especially when we're thinking about restricting eating disorders, and this is probably the area where my research has been mostly in, is facets of anxiety tend to be a huge risk factor for developing eating disorders during that adolescent risk period. And it can be lots of types of anxiety. It can be like social anxiety, perfectionism, over control, interoceptive anxiety, or anxiety about your physical sensations. And so I'm curious if you all have seen that. For me, it comes up clinically all the time when I'm working with adolescents, is that a lot of the kiddos that I'm working with are top of their class, involved in every sport, sing in the choir, in the musical theater, are really high achieving kids who are very anxious and perfectionistic. I don't know if you all have that similar experience.
100%. Yes, definitely.
Yeah. And also one thing as you were talking about that when you're talking about, puberty and stuff, there's such a broad timeline of puberty, especially in females now. Like girls are getting their periods as young as 8 or 9 sometimes. And then others are, not getting their period until they're 18.
Yeah.
How that might affect, like I developed really early. I had my period at age 10. Courtney, you were probably later because you're tall. People who are tall tend to have their periods later, and like how that affects your self-image.
Yeah. Yeah. What we know about that is that it's different for girls and boys. And so for girls, having an early puberty is related to some, and not always, but generally is associated with negative outcomes for mental health and adjustment and for eating disorder risk. Whereas girls that have later onset of puberty tend to fare a little bit better. It's a flip-flop for boys where early puberty tends to be associated with better adjustment and better outcomes. And so I think that makes sense. I think part of this for girls is another risk factor for eating disorders is being at a higher weight. And so the younger that you're going through puberty, the younger that you're at a higher weight, the more risk there is because you're navigating this world and the pressures of being in a world that doesn't want you to be in a higher weight. And so there's a lot more pressure, I think, for attempts at dieting and weight loss that can turn into eating disorders.
And I wonder too if it's sort of there are other protective factors, like maybe where you live or what culture you are in. I mean, I think I had a pretty healthy response to going through development early. Like I actually felt confident because I was like, oh, I have breasts before other girls or, whatever. But I can also imagine, your hips get wider, you get stretch marks. So I can obviously see the other side of things.
I also imagine, like being a young girl and now dealing with sexualization at such a young age, it can be really challenging for some people, right? Like having a more mature frame leads to a lot of unwanted attention, unwanted teasing. I think there is associations with early puberty and peer teasing. So there's so many things that go into it that it's hard to parse apart what exactly that looks like. We also see a lot, both with restrictive eating and excessive caloric intake, being associated with emotional regulation. Adolescence is a time where you're confronted with a lot of big things, but you haven't necessarily developed the skills for regulating your emotions or being able to respond effectively, and also being impacted by puberty and hormonal fluctuations. And so a lot of times that leads to unhelpful relationships with food in order to respond to this big feeling that's going on inside, whether that be positive or uncomfortable, anger, sadness, just even being tired is associated with different disordered eating behaviors. And so I think that's interesting. And it's also interesting. I felt like when I was growing up, there weren't very many kids in therapy or who knew anything about emotion regulation or had coping skills. I think it might be becoming more common for kiddos to have that be part of the conversation more now, which can hopefully be protective for developing eating disorder symptoms. But some of my research has been on what are some of the emotions that lead to these disordered eating behaviors, and what might intervention look like to improve emotion coping and hopefully prevent some of this disordered eating.
Would
Yeah,
you
I
mind
definitely
saying what some of the emotions are that are particularly correlated?
Yeah. So it really it depends on. It's not like a one size fits all is I guess what I can say. And what happens most often is it's negative emotion. So things like shame, guilt, sadness. It can be low self-esteem. It can be frustration or irritability or anxiety. But anytime we're feeling down for any reason, it can lead to seeking to control that, right? And so some people, some kiddos might control that through, okay, don't have control over this part of my life or this part of how I'm feeling, but I do have control over food. So I'm just going to rigidly control my food and then I might feel better. For other kiddos, that might be, oh my gosh, I just need relief from this feeling that's inside. If I eat a lot of food, then that might numb it for a little bit. I might get an escape from how I'm feeling. And so it's interesting that these same emotions can really manifest differently for kiddos.
Yeah, totally. And
Yeah, that
that's
makes
like
sense.
super consistent with, I think, at least what I see in my practice with teens and
Hmm.
adolescents, especially as a DBT therapist. Like that's how I conceptualize disordered eating starting, right?
Hmm.
As a coping mechanism for those uncomfortable emotions. And I think typically, like when I do assessment and like, gain information about like the development of disordered eating, I think one of the things that I frequently hear is like, I ask like when that started, what was going on at that point in
Hmm.
time. And there's typically something that happened, right? Some type of transition, big or small, that
Hmm.
was emotionally uncomfortable for the kiddo. And so they slowly turn to food to cope with those emotions. And I think another thing that you said, Caroline, too, is so many of the kids that I work with have struggle with anxiety. And I often say,
Hmm.
okay, so like when do you feel like that started, right? In your
Hmm.
life. And so many of them are just like, I don't remember not being anxious.
Yep.
Like that's just
Yeah. As
who
long
I
as I can
am. So
remember. Hmm.
yeah.
Yeah. Yeah. And I think there is like, it's amazing what changes you see in kiddos when you do see them in therapy and you give them some other skills they can use to regulate their emotions. And just like the amazement of like, oh my gosh, this also works, right? Like it's just the lack of having the skills or having the tools or having someone to talk to
Totally.
about it. And I also think a lot about, for kids that aren't going to come to therapy, what are things that can help them learn emotion regulation
Yeah.
skills, right? How can parents be involved in that conversation? How can teachers be involved in that
Yeah.
conversation? How can social media help kids learn these skills? I don't know if you've seen other things or have ideas about if we can't get a kid into the therapy room, how can we change? And it already has been changing, but how can we change this landscape about talking to kids about their emotions?
I mean, I think everyone needs to learn DBT skills starting in like kindergarten. So,
Hmm.
I mean, again, I'm like a huge DBT proponent, but I think like the skills of emotion regulation, distress tolerance, like those are just like basic human skills that would benefit
Hmm.
literally everyone. And so I think the earlier that we can get that into kids' mind, the better. And I think like
Hmm.
what better setting to do that than educational settings. Now, whether that will ever happen, who knows? But I think that that would be like ideal.
I think certain
Yeah.
states it could, and that's a great idea. Wilder is 9 now, which is like, I guess it's a period of adrenarche is what it's called, and they can start having some emotion dysregulation
Hmm.
leading up to puberty, and I definitely have noticed that. And even as a therapist, it's hard to do that in your own home, to help your kid regulate emotions and learn how to regulate their
Hmm.
emotions because you're so attached to it. So certainly that's a brilliant idea, Courtney, of doing it in the educational system where the teachers aren't as emotionally invested, right? Like if a kid's not using their skills, they're going to be like, okay, how do we use our skills, instead of me being like, wah.
Yeah.
Hmm. Yeah, absolutely. I mean, we have time for science and math and English. We can carve out a little time for DBT skills, group therapy, emotion regulation time. I think that's an awesome idea. Yes, I think there's a lot to learn and lots to think about with how we intervene. There's also something that I was part of was the body project, which I think Dr. Brown was on here and talked a little bit about that. But that's something that our field is working on every day. Again, that's going into schools, that's going into some of these educational settings where we can hopefully reach these kids and teach them about eating disorders and body image and appearance ideal and diet culture. And so I think that there's a lot of being done to figure out, okay, we know this time is super salient and a super big risk period. What are some of the different ways that we can get at these known risk factors? And then the other critical risk period that I've been big into recently is this pregnancy and postpartum time. Because if we're thinking about times of big physical change, I don't think that there's anything that really trumps going through pregnancy, and then that also transitions postpartum. And also when we think about the appearance ideal, it's hard to think of a time that goes more against the appearance ideal, right? Pregnancy is all about gaining weight, especially in your midsection, which society hates. And they make a little exception for pregnancy, but then the second that you deliver, exception's gone, and you're supposed to look like you did right before you had that baby. And so that puts a ton of pressure on new moms who are also navigating this new social identity and time and sleep and caring for life while also potentially having other lives that you're in charge of. And it ends up just being a really big risk period that we know there's a lot of increases in depression and anxiety that happen during this time period. But there's not a lot of people who are studying eating disorder risk during this time period. So it's kind of become my personal mission to better understand what are some of the risks for anyone experiencing pregnancy, even if you've had no eating disorder risk in the past. As you're navigating this time period and the expectations, how do people really develop either resilience towards eating disorder symptoms or disordered eating and body image concerns that develop during this period?
How did you become interested in that? I'm like very interested in it because I've had two children,
Hmm.
and I can also tell you a little bit about some of the crazy body changes. But it's so you're young. I imagine you don't have kids yet,
Mm-mm.
so it's so unselfish of you to care about something you haven't experienced. So tell me how that came about.
Yeah, I think for me, it was like this really odd amalgamation of all of the research experiences that I've had prior to getting into eating disorders. My first psychology research experience, I was in an infant lab. Yeah, it was the best experience ever. I was an RA and I just got to play with babies and older
Gosh, how
siblings while they
cute.
did like cognitive tasks and little games. And some of the studies that we were working on looked at emotion regulation in babies and how that might relate to parents' anxiety, depression, and distress. And so that had me thinking about this intergenerational transmission and pregnancy and early postpartum and just interacting with people who had recent lived experience with that. And then I did rat research for a little bit in toxicology, where I was looking at if prenatal smoke exposure in rats affected outcomes for offspring. And my job in that was super tedious. I like dissected rat livers, and it was kind of horrible.
Whoa.
It was not for me. But the idea in the study was really cool, right? So how is this prenatal time important for both the parent and the baby? And so as I get into eating disorders, I'm thinking about some of these things in the back of my mind, and just through observing the world and seeing how diet culture impacts pregnant people, I think it all kind of came together in just a weird brain baby.
That's cool.
Yeah, so all of this, and I started studying it in grad school. Inspired by some of these different ideas, started the Louisville Pregnancy Study, which was just collecting surveys at pregnancy through 1 year postpartum for anyone who was experiencing pregnancy. So there wasn't any requirement to have any mental health history or eating disorder experiences. There's no weight criteria. It was just if you're pregnant and older than 18, we'd love to hear about your experiences. And it was interesting because in this study, we found that the frequency of disordered eating behaviors was incredibly high. So during pregnancy, half of our sample endorsed restricting their eating due to weight and shape concerns during pregnancy. So while it's supposed to be eating more during pregnancy, as recommended, we're seeing people having these restrictive eating disorder behaviors. And we also saw that half of our sample engaged in binge eating during pregnancy and postpartum. It's clear that these are behaviors, even in this just general community sample, that are really prevalent. It's also interesting, like in the research, we see that there's different trajectories of eating disorder risk during this time period. And what we find overall is that people who have an eating disorder history or elevated eating disorder symptoms before pregnancy, eating disorder symptoms tend to go down during pregnancy and postpartum.
I remember Walt K talks about that a lot.
Hmm.
So that's why I was so surprised for you to say that the half of the restricting,
Hmm.
the binge eating makes sense. You know, Leslie and I used to joke, Leslie's my best friend, and we were like, there's no way we could have restricted during pregnancy. Like
Hmm.
ravenous. Like I remember her walking into team one day at UCSD. It was like she had a platter of fruit and it was unreal. She was just like, I need so much fruit. And I felt the same
Hmm.
way, like ravenously hungry. So the
Yeah.
restricting seems impossible. But I guess people have different hormonal responses, right?
Yeah, and there's also, with there's food aversions, nausea, morning sickness, we can see some difficulty eating, but this wasn't even related to that. This was restricting in order to try and control your body size. So I think it is interesting, and I think it might even come from, healthcare providers and these norms across pregnancy that, okay, you should gain weight, but you should really manage the amount of weight that you're gaining, right? You need to gain X amount, but not more than that,
Oh,
right?
they're like on you about it. Like
Hmm.
I had to school the doctors at both UCLA and Cedar Sinai, more at Cedar Sinai.
Hmm.
And literally with the second pregnancy, they were like, "Oh, you're already in a larger body. You don't really need to gain any weight this pregnancy. Like your
Hmm.
baby can live off of your fat." Yeah, yeah, that's what people get told.
Oh my
Yeah.
God.
Mm-hmm.
Oh my
Yeah.
God.
Which I, of course, said, "Yeah, no, I'm going to do whatever my body needs." And it did. And I had very big,
Hmm.
healthy babies.
Hmm. Yeah. Yeah. So there's a ton of weight bias in healthcare that we know about, and especially in obstetrics, right? That people in larger bodies get treated very differently when they're experiencing a pregnancy, not only because there's different risks involved, but just because there's stigma that, oh, you're in a higher weight, so you don't need to gain weight, even though you're growing a baby. And we know that restricting your eating, not eating enough during pregnancy, can have a lot of like really deleterious outcomes for the baby. So it can be bad out there. There's some hugely wonderful weight neutral obstetricians out there, and there's a lot who just don't have education about it, right? There's a lot to know in obstetrics. And I think, unfortunately, disordered eating, body image, weight stigma really gets pushed to the bottom of the stack a lot of the time. Yeah, so for people who have eating disorder history, we tend to see decreases during pregnancy, maybe because it's hard to maintain high eating disorder symptoms while you're growing a life. And there's sometimes this shift in priorities towards wanting to be healthy for your baby and relinquish maybe some of this disordered eating. It can also be a huge empowering thing to see that your body can do this amazing thing. It can shift some focus away from trying to control rigidly how it looks and maybe gaining a new appreciation for it. But what we see for people who might have low eating disorder symptoms is there's often this increase in symptoms during pregnancy and postpartum, which might come from the big physical changes and challenges that come with that. Suddenly having a body that you don't connect to or that feels like it doesn't meet an ideal that it might have used to meet.
It was super interesting. One of my good friends from grad school is someone who really had never had any issues with body image or food.
Hmm.
Always someone that I kind of really admired in that regard. And then when she got pregnant, it wasn't until after she gave birth and,
Hmm.
still had the weight on her that she was started to talk to me about how she really was struggling with body image
Hmm.
and struggling with like food intake and things like that. And it was so interesting to hear her for the first time following pregnancy really have heightened body
Hmm.
dissatisfaction. And, she was talking to me a lot about it because she was like, what do I do? Right? Like, how do
Hmm.
I navigate this? And yeah, it was just super interesting.
I'm like, "Are
Yeah.
you talking about me, Courtney?"
No,
Because I was the exact same. Actually, I just got asked to write a piece for International Journal of Eating Disorders about my experience
no
going from
way.
having like no eating disorder, working in this field, to and being in a small body, to being in a
Hmm.
large body, to being back in a small body, and how that,
Hmm.
you know, dealing with weight stigma and all of that. And so I see postpartum as, I'm going to guess, is even more risky than pregnancy, because then you're breastfeeding, but you're a lot of the time, but you're not like growing the baby. So I can see you
Hmm.
becoming more selfish, about what you're putting in your body.
When seeing this out there, that's what I with part of the Louisville pregnancy study, we have some qualitative data that's looking at, okay, what is it about this time period that might increase symptoms for some people and decrease symptoms for other people? And so we asked these qualitative surveys at 8 weeks postpartum, and a lot of the responses that we got for like how people are responding to these body changes were that I loved my pregnant body, right? I felt like so empowered by growing this baby, but now that I'm postpartum, I look at my saggy stomach and it hasn't gone away the way that I wanted to. Again, this is 8 weeks after having a baby, and this expectation that my body should just like, boop, right back. And that's just not how bodies work. And
I
so,
mean, some
uh,
people's do, and then those are the
mhm,
people that people are glorifying. I
mhm,
also, speaking of TikTok, I remember being bombarded with things about the C-section shelf. I was like, I didn't ask for
mhm,
this. It's basically where your scar is really tight on your pubic bone. So any adipose tissue is obviously going to
mhm,
kind of fold over that. It's just like anatomically
mhm,
what's going to happen. And I remember being bombarded with TikToks being like, how to fix your C-section shelf. And I'm like, what?
mhm,
I just had a 10.5 pound baby come out of that thing. Like, what are you
mhm.
talking about? You know?
Jeez.
Yeah. So yeah, postpartum does tend to be pretty risky because, yeah, like you said, there's not a baby to feed and care for anymore, right? So sometimes mom is last at making sure that you have enough milk for breastfeeding, and then you are never priority one during that postpartum period. And so that can be part of it. This expectation that this should be easy, you should look better, you should be super mom. And probably other things, right? Who's showing up for you in your community? How are you seen when you're out and about? Are you able to go out and about? Are you experiencing postpartum depression and some of these hormonal fluctuations as you're coming back to finding yourself in this new identity? So yeah, that postpartum period is really tough. And a lot of what we also saw with the qualitative data is people saying, I feel neglected by my maternal health providers. They were really there for me during pregnancy, and now I see them like in 6 more weeks and I don't know what to do. And so I think that it's just a really challenging period. And what we see as some of these protective factors are things like having good provider support, having good resources, having a strong community.
Or like a postpartum doula, maybe also is probably really helpful.
Yeah. Oh my gosh, every time a doula was mentioned, it was with the most glowing. If anyone can have access to a doula, I recommend it because that ends up being incredible for a million reasons during this period.
And again, something that should be provided in our health
Hmm.
system because it's extremely expensive. It's thousands and
Yeah,
thousands of dollars to have a doula. And it's not
yeah,
covered by insurance, but the mental health and physical health outcomes are dramatically improved with a doula.
Fascinating.
yeah. We have actually in Pittsburgh, we have a super wonderful women's hospital, McGee Women's Hospital, and they have a program that provides doulas to women who are giving birth there, and they really are fantastic. And it's hard because that's not standard, it's not affordable for many women. So, and another thing that tends to come up a lot is this difference between responding to these body changes with acceptance or even empowerment of the amazing thing your body did versus responding to your body and these changes with self-criticism or judgment or shame. And so I think that's something where therapy can be really useful, right? How can you change this response? And I think there's other ways that we can really target, like thinking about healthcare again, right? How can we set up these helpful expectations about what bodies do look like after pregnancy? The shame that comes out, how can we assess that and encourage self compassion when the cool thing about obstetrics care is that you have a pretty captive audience, right? That you're seeing people pretty regularly throughout the course of the year. And so even just like a handout or an app or a 5-minute discussion, I think can go a long way rather than these settings where it's like, okay, don't gain more than this amount of weight, bye, it has a huge potential to be helpful and harmful. And so I think that's where the last bit of my research is going is how can we have these conversations with obstetrics providers and maternal health providers about providing weight neutral and personalized care, how to assess for eating disorder symptoms during pregnancy and especially during postpartum, and how to make that sustainable within these systems that tend to be overburdened. No one's giving them extra time or extra money to do this. So how do we make that feasible?
Right.
That's awesome. I
Definitely.
think that's a great direction.
Yeah. Yeah. I think that's great too. It's so needed. I think we focus so much on, yeah, like teens, adolescents, college students, even.
Hmm.
And I think individuals later in life that
Yeah.
develop eating disorders or struggle with eating disorders at that time are really neglected.
And it's
Yeah.
really critical because at that time they're raising a human. And if you are
Hmm.
depressed or experiencing an eating disorder or addiction, which also increases after having children,
Hmm.
you're raising a human in that environment. So it affects a lot more than just the mom. It affects their offspring and their partner as well.
Yeah, I think that's a great point, Dr. Courtney, about as we get older, there's less attention, there's less care. I have some collaborators who do a lot of work with menopause, and it's just this uphill fight to get people to want to care for older women, right? Yeah, so incredibly important. And not that adolescence isn't important, it very much is, but it's such a good take home message, I guess. We don't just get to forget about women once they get a certain
No,
age.
Yeah, the time
absolutely not.
periods that need a little more love. Adolescents have a
Hmm.
lot of love.
Well, Carolyn, that was super interesting. Thank you so much for talking to us about that. Love to go into.
Interview the expert.
Well, why don't you start off with telling us just a little bit about where you're from and where you grew up and what that was like for you?
I grew up in Kentucky, in a small suburban town in Kentucky. It's called Fort Thomas. Go Birds. I grew up with my family. My two parents lived together, and then my brother and our dog Sadie. And I had a nice childhood. Yeah, I think. I mean, I think there was a little bit of that suburban mom walking club. There is just it was a little diet culture ridden, as I think a lot of places are, especially growing up in the early 2000s, southern suburban, just all the stuff that comes along with that. So I think that definitely, at least on a implicit scale, influenced my interest in this area, and I still pull from those experiences all the time when I'm working with clients and doing my research.
Yeah. Yeah, that's what I'd love to hear a little bit more about next is just kind of like what inspired your interest in psychology and how did you get into the eating disorder field?
Yes, I took psychology classes in high school, and then I was pre-med. I'm the classic pre-med to psychology pipeline. Um,
Same.
yeah, it was that rat research. I was trying to do bio research and like doing Western blots, and the smells of wet lab work were just not for me. And then I started working in the infant lab and seeing how interesting behavioral research could be and working with human participants. And so that's my senior year, I decided to shift to do psychology research instead of being on the pre-med route. And I was interested in clinical psychology, so I wanted to get more experience in a clinical psychology lab. And so I sent emails to like all of the clinical psychology labs to see who would take me. And then the eating disorder lab was the one that reached out. So it was
No
kind of
way.
this random, okay, I'll study eating disorders. And
No
then
way.
as I got into it, it was just like an immediate passion. It was like seeing how much work there was to be done and this fight for women's issues and getting funding for this area that is so far behind, like depression and anxiety, and just things that I could do were really exciting. The participants that I worked with were really incredible, and so it just was dipping my toe in. It kept spiraling, the research ideas and the needs that became really evident.
Okay. If you were not a psychologist, what would your career be?
That's a great question. I think I would want to work at a zoo. I always said I wouldn't be like a wild animal obstetrician and just get to deliver little animal babies and hang out with them in a little animal NICU and wander around the zoo with like my tan outfit on, like, feeling cool and in charge of stuff.
Do
I
you
think
wa-
that would be really cool.
do you watch that Disney vet show? They basically it's like following the vets at the safari park, at the Disney safari park, and all the cool
No.
stuff they do. You would love it.
Oh, that is so cool. It's because there's too many streaming platforms. Like can't afford all of them. So, but okay, maybe I'll prioritize that because I do. When I was a kid, I like always told everyone I was going to be a vet. And I think there's definitely a universe out there where I did that.
That's cool. That'd be so fun to work with a lot of like cute little animals all day.
Yeah, it's not enough just to go and like see them through the window. Like I want to be responsible. I want to hang out with them and trade them. And yeah, that would be a fun job.
One of my colleagues this week, actually, on my team, we were in the lunchroom and she was saying that she has this, like, she knows it's irrational, but she has this irrational belief that she could befriend any animal except for a shark. And so I was like,
Mm.
what about a hippopotamus? And she was like, absolutely, like, definitely. And I'm like, oh my gosh, Jessica, what? And so we just kept on talking about like all of these animals that she truly thinks that she could like become friends with that are like very dangerous. And I was like,
Yeah,
this is how you're going to die. Like you are going to you're
yeah.
going to die by trying to make friends with an animal. And she does, like, she goes on a lot of exotic travel. So like she's been to
Mm.
Antarctica and she just got back from going to Botswana this winter. So like it's not out of the realm of possibility.
Hmm. Yeah. I watched that chimpanzee documentary, and yeah, I don't know if you can befriend every animal. I think a healthy respect is important if you're going to be close to them.
Yeah, yeah, definitely. Well, speaking of that, do you have any like unusual talents or skills or irrational beliefs about yourself?
Oh, I would say my talent. It's really hard for me to call it a talent. I can call it a hobby. I'm a potter. I'm a ceramicist, so that's something that I enjoy. I also play tennis enough to be passable. So I would say those are some of my talents. If I can be bold, if I can say that those are talents.
What is a hope or dream that you have for your future?
That's such a good question. It's hard to hope for anything other than just happiness, to like live a long life where I can feel satisfied with
Yeah.
what I get to do in my job and with the people I'm surrounded by. And if I could be like really specific, it would probably be in the mountains somewhere where there's like a little stream rolling by, and there's just happiness when you wake up and you go to bed.
I love that.
Well, do you have any homework? You better work for us.
Work it, y'all.
Yeah, absolutely. Yeah, so my homework is to just take a minute and try and appreciate how your body's changed and think about how it might continue to change with a lens of acceptance rather than control. Like maybe doing one thing to step back from trying to control your body or judging these changes. It's something that comes up when I would do clinical work with adolescents or people who are struggling with how their bodies changed, to reflect on how amazing it is that our body changes, right? If your body didn't change, we would just be these big baby bodied adults, right? And so it's like so great that we don't look like babies and that our bodies can make us do all these things that we
Thanks,
couldn't have
picturing
done when we
like
were younger.
herself as a baby right now.
Like an adult
Yeah,
baby.
that's what when I'm working with kiddos, they're like, yeah, I am glad I don't look like a baby. And it's like, it's just like the smallest spark of, okay, maybe I can find some appreciation in this. So yeah, just maybe taking a second to think about that. But the ways that your body's changed that might have served you in some way.
Yeah, I love that, taking a functional approach. I know that that's been helpful for me at times for sure. Cool. Well, thank you so much for joining us on our podcast today, Caroline. This was wonderful and so informative. So we really appreciate you being here.
Yeah, thank you so much for having me.
Well, join us for our next episode on religiosity and eating disorders. We'll see you next time.
Thanks for tuning in. Remember to rate, review, and subscribe. See y'all next time.